that out of this whole traditional medicines, through the traditional medicine, how many people we have cured so far? How many diseases we have cured so far? How much prevention we have managed so far? There's no storytelling anywhere, and there are many in the society, but we have not been able to glamorize it, market it in a way the way it should have been. So the results are not there, the trust is not there, the connectivity between the people and these medicines are not there. Just yesterday, we decided, inshallah ta'ala, and I'm going to work on it, inshallah ta'ala, that in our hospitals, there has to be a traditional medicines desk as well in the same hospitals, inshallah. We have to create a space, we have to create a position. Where would all these qualified people will go? How many people these companies will hire? How many students, qualified students, will have their own TIB? So there's no, the mechanism, the ecosystem is not there. The encouragement is not there. And like it's been said, always say, the prevention is better than cure. And I was just mentioning about the cure, that we have to make people, enable people not to fall sick. The environment, and that's not the responsibility of any health ministry, to prevent people not falling sick. That's the responsibility of each and every soul, the entire society. For instance, like we say, 70% diseases are the water-borne diseases. We normally say that. That's the calculus. 68-70% diseases are the water-borne diseases. So that means that you have to provide the clean drinking water. That's not the job of the health minister. All the way from 𝗪𝗪𝗪𝗪 till Karachi, we do not have the sewage treatment system in Pakistan. I'm sorry I say it, just to recognize the problem, so that we will have the solution for that. Unless and until you don't recognize you don't diagnose the problem, how would you come up with a solution? So right top on the mountain there in 𝗪𝗪𝗪𝗪, a neighborhood which flushes their sewage, there's no sewage treatment. It goes to someone's drinking water, the next neighborhood. Through all these river, stream, other sources. And when they flush their own sewage, it goes to the another neighborhood, clean drinking water. Yet we call the 70% diseases are the waterborne diseases. When there's no sewage and there's no chip in our national mindset, we don't see it as a problem. Very unfortunately, any officer or office or authority which is approving that neighborhood allowed to be built, would they look at it? What's the checklist? Whether they will provide the road infrastructure or not, whether they will provide the parks or not, will build mosque or not, will provide the electricity or not, will provide the gas supply and drinking water supply or not. Nobody has seen till today that whether they will be provided, that neighborhood will be provided the sewage treatment plant for that neighborhood or not. Not even single neighborhood or housing scheme has been cancelled not to have the sewage treatment plant. So, ladies and gentlemen, blaming an authority is an easiest task. But is it helping someone? No, it's not helping anyone. We all have to be very cognizant, every soul. We have to educate everyone. It just starts from that human being to take care of themselves. We have 13 vaccines available here in Pakistan to prevent the diseases, which the government of Pakistan provides free of cost. It's available to every child. But yet there are certain amount of people who refuses to take that vaccine. What would you do that to that people? They are till today the zero dose Children here in Pakistan, 360,000. Those are potential human beings to fall sick here in Pakistan. So we all have to be very cognizant about our own health. Then only this burden of diseases could be reduced. Yes, government has its own role to play, and government is not that ideal situation. There is an ideal situation here in anywhere, but we all have to work to first we all have to understand it. It's not that everybody will fall sick and government will take care. No, that's not the case. We have to work on those lines where we should not fall sick. We should be preventing those diseases. So conferences like these, the government of Pakistan, we are fully supportive. We are with you. Definitely, the leads should come from there. We call ourselves as a facilitator, and anything and everything which is needed to be done by the government, by the health ministry, rest assured it all will be done. And this is what the aim and objective of this entire ministry is, that we have to convert this sick care system to a health care system. To sick care system to a health care system. That's why I'm not interested in building many hospitals.
इस्लामाबाद में वफाकी वज़ीर सेहत मुस्तफ़ा कमाल तकरीब से खिताब कर रहे हैं.